Hello, hello. Thank you so much for joining us and welcome. My name is Susan Weinstein. I am co-executive director at Families for Depression Awareness. We are an organization that helps families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. We're very caregiver focused. We're very much about education, and we're also about caregivers learning how to take care of themselves so that they are able to take care of other people too. Today, we are going to have the great opportunity to watch a video and then speak with an expert in transgender mental health care. You may be watching this on Facebook. You may watch this later on in a recorded version on YouTube, but you'll find us online at familyware.org and on Facebook, Instagram, and Twitter, or X. We're at Family Aware. And on YouTube, we're at FFDA1, the number 1. All right, so please do feel free to jump into the chat, say hello, share your thoughts, and we may be able to run some comments on the banner running on the bottom, but also we're trying to share some information that we hope will be helpful to you. Now, let me introduce and bring into the stream Dr. Alex Keuroglian. He is Associate Professor of Psychiatry at Harvard Medical School and Director of the Division of Education and Training at the Fenway Institute, and Director and Michelle and Howard J. Kessler Chair of the Division of Public and Community Psychiatry at Massachusetts General Hospital. And there's a lot more that you could learn about Dr. Keuroglian, but I can leave it to you to read that on our website instead of taking up our time now. Welcome so much. I'm so appreciative of you being here.
Thank you so much for having me. Looking forward to speaking with you and your participants.
Do you want to talk for just a minute about Fenway?
Sure. Fenway Health is a federally qualified health center in downtown Boston, across from the ballpark where the Red Sox play. It's now 52 years old. We recently celebrated our 50th anniversary in 2021. And from the beginning, Fenway's been focused on providing the highest quality care possible for sexually and gender diverse people. Certainly once the HIV epidemic hit in the 1980s, that became a primary focus. We're now the largest provider of HIV services in New England. We see over 2,400 people living with HIV in primary medical care each year. We're the largest provider of transgender health services in New England. We see over 4,500 transgender and gender diverse people in primary medical care, and generally serve a very large LGBTQIA+ population. We also are unusual as a federally qualified health center in that we have an institute, the Fenway Institute, within our health center that focuses on research, education, training, advocacy, and policy for LGBTQIA+ folks. And both in terms of clinical services and in terms of the research we do in education and training, we have a major mental health focus.
Awesome. And I've been familiar with Fenway for a long time. And I know that we in the Boston area and New England in general are incredibly fortunate to have this resource here. And I really appreciate the way that Fenway has grown and been able to help other parts of the country develop programs as well, and be able to treat LGBTQIA people as they deserve to be treated, with sensitivity and competence and compassion and good medicine.
Yeah.
All right, so as you know, we're going to be able to watch this video that was recorded by us. Family stories are incredibly important to the work that we do, because we know that people learn from them and they get inspired by them. And we're very fortunate to have this one from a volunteer of ours, Lori, and she'll be talking about her transgender son, Carter. So I'm going to get that started. And Dr. Keuroglian and I are going to move off of the screen, and we'll be back on to talk about it. So please enjoy the video.
I have two adult sons, both of whom deal with some anxiety, and one of whom has a significant history with depression and who is a transgender male. When I first noticed signs of depression in Carter, he was 7th, maybe 8th grade. He had been a very outgoing elementary school child, and by middle of middle school, he began to get very quiet. He began to isolate more, be more intimidated around his peers, and he had a phone by 8th grade, and he started sticking his nose in his phone a whole lot more rather than looking up and participating in life. Our role in getting him treatment began with really understanding what was going on with him, because while we understood that he was questioning his gender identity, we didn't know a lot about depression, and we did not know how to parent a teen with depression. He was expressing a lot of self-doubt, and we thought that was a school concern and a peer concern and adjustment to his new school environment. So we sought input from the school counselor, who began talking with Carter about depression. We worked with her for quite a while. She met with Carter quite regularly, educated him about depression, and recommended to us that he get an independent therapist outside of school. He was a difficult to treat teen. He was very treatment resistant, and we had to try a number of different therapeutic modalities and environments. So we began with talk therapy that included a little bit of cognitive behavioral therapy. And he was very optimistic at first, but when it wasn't a magic pill for him, he became soured and decided quickly that therapy was not working, which was a factor of his depression and also his personality. He had several inpatient stays because he was expressing suicidal ideation. And again, he believed that the inpatient stays were supposed to somehow miraculously cure him of his depression without him doing any work. So when he came out still feeling depressed, he became more depressed. So we were on this cycle of descent into harder and harder times with him. And one of his therapists ultimately suggested to us wilderness therapy because the traditional residential programs were not helping and outpatient therapies were not helping. So in a moment of complete desperation, really, we sent him to wilderness therapy, and that was the start of better times for us. The types of things as a caregiver that I have employed came with time and learning, so it wasn't natural in the beginning, but I did learn that with his permission, I needed to be more open about what was happening in our family so that our friends and family could support us and give us, honestly, breaks when we needed it. It's very, very hard to parent a teen with depression, and it can feel debilitating because whereas everything you've ever read in the parenting books seem to have success here and there is no real roadmap. It just depends on the child. And so we were not natural experts in how to help him or how to take care of ourselves in that process. So in terms of Carter's gender identity, he was identifying as non-binary, and it wasn't until he came home when he began to talk about identifying as male. And I don't know if it's tied to being more comfortable at home and with us, but that's when it happened. And for us, what we observed was once he came out as male, we were very accepting and open and curious and non-judgmental. He began to bloom in a way we hadn't seen before. He began to feel comfortable and excited about the changes he could make in his body and his life. And it definitely impacted his improvement in terms of his depression. Carter he receives therapy now about once a week, sometimes a little bit less, but specifically through an LGBTQ plus friendly therapeutic group. I think that's very helpful and validating for Carter to have that therapist. He also takes medication to manage his depression, and I think that that gives him a baseline comfort and ability to be able to engage in therapy. My advice to families who have a child or teen with depression is to get busy, do your research, talk to people, find your other parents who are in a similar situation, because that's where you're going to get support and advice that you may want to try. If you have a child in the LGBTQ plus community, they need to know that they are part of a really wonderful part of society, and find their friends and have people to lean on. It's great as your parent that you are supportive and welcoming and embracing, but you're their parent and they need people outside of their family unit to validate that who they are should be celebrated. In some weird way, the hardest experience of our life as a family has improved our lives, every single one of us as well.
There's so much in that video. So I'm going to narrow us down, and we'll talk about the transgender issues more than anything else, and mental health care for people who identify as LGBTQIA+. So was there anything in particular that stood out to you about her experience?
Such a compelling personal narrative, and really representative of what we see so often in terms of the critical importance of strong family support for gender affirmation, and the ways in which strong family support is associated with improved mental health outcomes, improved academic performance in many cases, and studies have supported this, improved socioeconomic outcomes down the road. So it's important for families to not underestimate how vital their affirmation and acceptance of their loved one is with regard to gender identity or sexual orientation, and to express a commitment to that to your loved one and an openness to learning how to support them, because it may not be something that you've thought much about before or have significant experience with.
I think, in my lifetime, I know that you can't take family support for granted. You can't know that it's going to be there. But, Lori's love and support of Carter is just so obvious and so inspiring and heartwarming. How can other families, whether it's a biological family or adopted or chosen family, how can they support the mental health of their LGBTQ loved ones?
Expressing acceptance is the most important first step. We all have implicit bias, sometimes explicit bias, against LGBTQI plus people. Even those of us who are LGBTQI plus or are transgender and gender diverse have internalized the kind of bias that exists in society. So we all have our work to do unpacking that and moving toward a place where we can really celebrate this diversity and the beauty that is inherent to it, as Lori so eloquently said in the video. And there are many resources for families and loved ones of LGBTQI plus people that folks often don't know they can tap into. PFLAG is a terrific organization, many chapters across the country, certainly in Massachusetts, for example, where we're based, there are PFLAG chapters, and there's a presence really anywhere you may be. And that's a resource specifically for families and loved ones of LGBTQI plus people to gain support from one another and how to utilize resources to accept their family member. It's also important for people trying to support an LGBTQI plus person to understand how sexual and gender minority stress works. The idea is that LGBTQI plus people, and certainly this is true for trans and gender diverse folks, experience everyday discrimination, victimization, microaggressions, frank violence, unfortunately, at a much higher prevalence than the general population. And that starts in early childhood and continues and evolves through adolescence and across adulthood. There's really an intersectional component to that as well. For example, the FBI has reported in recent years that one of the populations with the very highest incidence of hate crimes in the US are African American transgender women. And that's the horrific reality that many people are dealing with. So we think of all of that as external stigma-related stress, which over time for many LGBTQI plus people can contribute to difficulty with relationships, regulating emotions, having certain beliefs that are totally understandable that would develop in the face of this kind of chronic stigma and discrimination, but that can perpetuate distress over time, like believing it's never going to get better, nobody can be trusted, no one will ever love me, for example. And all this external stigma-related stress can contribute to internal stigma-related stress, internalized homophobia, internalized transphobia, believing all the negative things that society has to say about your identity or expression, expecting rejection because you're so accustomed to it, including expecting it from your family, and identity concealment to prevent mistreatment or abuse. And all this external and internal stigma-related stress, we think, contributes to what we see in the research, which is higher prevalence of depressive disorders, anxiety disorders, post-traumatic stress disorder, substance use disorders in many cases as a way to cope with all this stress, decreased self-care, decreased engagement in healthcare, including mental health care or primary medical care, down the road a much higher prevalence of various physical health problems as well. So that's a sexual and gender minority stress framework. It's important to think about this as a minority stress and resilience framework. So how can we promote resilience and adaptive coping for our LGBTQI plus loved ones? LGBTQI plus people, trans and gender diverse people specifically, shouldn't have to be more resilient, but the reality is that people do become more resilient in the face of all this adversity. And there is increasingly discussion of a minority strength framework rather than a minority stress framework. So shifting away from deficits framework toward a strengths framework is, I think, a really exciting transition in the field. And if family members understand that, then I think that can breed a lot of compassion and an awareness of the range of societal challenges that are contributing to your loved one's depression, for example. So, it's not so easy to snap out of it. It never is. But I think sometimes when people understand the particular culturally specific external stressors and drivers of depression, that's very helpful for families to be able to support their loved ones.
I think in my question, I glossed over something that we probably should talk about. And that is, if a transgender or LGBTQI person is not getting what they need from their family, then I think that they should know that they can turn to other people too. And that's what we refer to as chosen family. Is that something that you often see?
Yeah, very often. And we can't always count on our family of origin, our blood relatives, to understand and support and accept us, at least right away. In my experience, my personal experience and in my clinical practice, it can take years for family to come around and really understand. And in some cases, that's not something we're able to have in our lives. Some people from our families of origin, our communities of origin, may never understand us. So many LGBTQI plus people, trans and gender diverse people, have to go and build families of choice, as you said, to find community, to find supports. And that's really a vital source of resilience for many LGBTQI plus people, and really something valuable for all LGBTQI plus people if they're able to access and build that. So we, as healthcare professionals, certainly are mindful of that. And a lot of what we do through our national LGBTQI plus health education center, where we're doing training, technical assistance, capacity building, is to revise forms and procedures within healthcare settings and mental health care settings for these to not assume that people have blood relatives involved in their care, that many times, it's kin who are chosen family, and historically policies in healthcare settings and who has access to patient information or who's able to participate in their care has been restricted to traditional legal relationships or blood relatives. And we do a lot of work for health systems to adopt a much more expansive approach, really based on who is important in the LGBTQI plus person's life.
I mean, to us, having connectedness is really, it can be a game changer for people. And, I don't have to tell you, but I'll tell her, social connectedness is a protective factor against risk of suicide and supports mental health generally. So if there are people who are watching this, then, I mean, and it's not just the LGBTQIA person. I mean, their caregivers should know that their own connectedness feeds their mental health as well.
Yeah, absolutely. And as with all depression, there's a tendency to isolate, to not engage in the activities that you used to enjoy. And that's precisely what we need to do when people are struggling. And there are entire treatment modalities based on that principle, like behavioral activation, which is an evidence-based manualized treatment protocol for depression that we implement in a lot of settings and do that work around the world as well. It's really about engaging in those behaviors that are reinforcing and rewarding and enjoyable. And much of that has to do with socialization and community, which is particularly important when you're depressed or when you're taking care of someone who's struggling and at risk of burning out yourself.
Definitely. So other than the forms that are not welcoming, what barriers to treatment do LGBTQ people face when trying to access mental health care?
Yeah, it's a great question. Well, care for LGBTQI plus people or gender-affirming mental health care specifically have not historically been part of the standard curriculum. In medical school and training of psychologists and training of social workers and training of nurse practitioners, for example, in residencies after that. So it's often the case that clinicians have a transgender or gender diverse patient in front of them or an LGBTQI plus patient in front of them and are playing catch up after the fact once they've completed their formal training period. And that's where our, for example, National LGBTQI plus Health Education Center comes into play. We offer all kinds of continuing education credits and programming specifically around mental health as well. But it should really be happening in the standard curriculum, right? And we're only seeing people who voluntarily are reaching out to us or organizations that want to train all their staff, but many organizations and many individual clinicians aren't doing that. So one problem is that the workforce hasn't been adequately trained to know how to provide culturally responsive tailored care for LGBTQI plus people. Another problem is that the care environments are not inclusive and welcoming. Part of that is things like forms and procedures, not using universally inclusive language, certainly. Part of it is that staff aren't trained to or protocols aren't in place for systematic, sensitive sex orientation and gender identity data collection that we use to provide patient-centered care. And that's also related to the electronic health record systems not necessarily being set up to collect that information and to then utilize that information to improve the quality of care in a culturally responsive, affirming way. There's also often either a lack of sex orientation, gender identity, and gender expression non-discrimination policies in place, even though that's a requirement of the Joint Commission, or those policies aren't particularly being enforced. So they may be on the books, but do all patients and families and all staff know these policies, know what recourse they have if there's an incident? Who do you go to express concern, and in what reasonable amount of time can you expect to hear back from the organization with decisive action, for example? And another problem is that we don't necessarily have full representation of LGBTQI plus people in the workforce, right? We want a workforce that reflects the full diversity of all the communities that we seek to serve, and that has implications in terms of decision-making within mental health practices. If communities are at the table in designing these health services and in delivering them, they're going to be much more culturally responsive. And in addition to the workforce needing to reflect that diversity, it's great to have a community advisory board that can guide any mental health care practice or organization to provide LGBTQI plus responsive care.
So you do see that there are solutions to these systemic problems.
Absolutely.
You mentioned the Joint Commission. Can you just say what that is?
Oh, sure. This is a regulatory commission essentially for health systems nationally, and there are certain requirements for hospital, for example, to maintain its accreditation. And non-discrimination policies along these lines are a requirement of the Joint Commission.
So let's say that someone who is looking for advice on finding LGBTQ plus affirming mental health practitioner. Maybe it's a caregiver reaching out and they don't live in Massachusetts. So what do you kind of tips can you give them, and what kinds of questions should they ask of a prospective provider to see if they might be a good fit?
Yeah, great question. This gets back to your important point about community and supporting one another in this regard. The best recommendations are going to come from LGBTQI plus peers and community members who will tell you directly that they've had great experiences with a particular practice or clinician and maybe not so great experiences elsewhere. That is going to be the most reliable. And there are LGBTQI plus focused community health centers in many parts of the country. Certainly we have Fenway Health in Boston. There's Chase Brexton in Baltimore. There's Whitman Walker in DC. There's Lyon Martin in San Francisco. There's Howard Brown in Chicago. There's Legacy in Houston, Texas. There's the LA LGBT Center. There's CalNord in New York City. Granted, those are all in major metropolitan areas. What you can do is connect with the LGBTQI plus community organization, not necessarily a healthcare organization in your state. Reach out to them and they will know where people tend to go for care. I can tell you, having done work in literally every state in the country with regard to LGBTQI plus care, that there is a practice, at least in every state, that's focused on care for this population and does a great job. And even though there are telehealth restrictions, telepsychiatry restrictions across state lines that are a little antiquated and unfortunate, and a lot of people are working on that, within your state, I can assure you that there is at least one great mental health practice focused on care for our communities.
That is encouraging. And especially, these days, although, these decades, there is a lot of overt discrimination and hostility against members of the LGBTQ community, and, both as individuals and as a larger community. What can you say to give people hope?
Yeah, it's certainly very distressing and dangerous to have the kind of particularly anti-trans and gender diverse rhetoric that's out there, and anti-LGBTQI plus as well. There's an incredible amount of disinformation from a very well-organized, widespread, and unfortunately quite violent political movement that wants to restrict the rights, and specifically the health rights of LGBTQI plus people, particularly so far with an emphasis on trans and gender diverse youth. And this is despite a great deal of evidence to the contrary in terms of research and strong support for, say, gender affirming care from the American Psychiatric Association, the American Psychological Association, the American Academy of Pediatrics, the American Medical Association, the Endocrine Society, the Pediatric Endocrine Society. And all of this is really terrifying for young people and really members of our communities across the lifespan. And people don't know where to go for care. I will say that I think this is a backlash to tremendous progress that's been occurring in recent years. And I think the long arc is that there will continue to be incredible progress in terms of LGBTQI plus rights and trans rights moving forward. So this is a terrifying and unfortunate blip. That being said, if we're persistent, vocal, and unified, I think we can counteract this, and I think better days are ahead.
And I think, from our perspective, the more that family caregivers can be involved and be supportive and be advocates, the better off our whole society becomes.
Absolutely. I think community support, family support, caregiver support can mitigate so much of the harm that comes from this kind of political opposition.
All right, people got to keep standing up and speaking up for sure. Thank you so much for joining us for this. It's been incredibly informative, and just really appreciate your thoughts and expertise. And to the audience, thank you all so much for tuning in. Please visit our website at familyware.org and stay connected with us on our social media channels. Hope you have a great rest of your day. Thank you so much.